Hi, Dr. Adam Goldman of the Metropolitan Vein Aesthetic Center. I want to talk to you today further about sclerotherapy, the treatment for spider veins. I spoke earlier in an earlier video about some basics, how to prepare, what to expect, and the aftercare. Today, I want to talk about strategies to minimize the discomfort. Unfortunately, this is probably the most uncomfortable thing that will be done to you during the treatment of your veins. So I want to kind of discuss what your options are and what the best strategy would be to kind of get you through the procedure with the minimal discomfort as possible. So the first thing you could do is that prior to coming, it may help to take some tablets or analgesia before you come. So you could take Tylenol, Advil, Motrin, let's say about 2 to 4 hours before you come. I would take some higher doses. Let's say it's Tylenol. I would take 500 milligram tablets, 2 of them before you come. Or let's say Advil or Motrin, take 200 milligram tablets, which are sold over the counter. You could take 3 or even 4 of those. If it upsets your stomach, you can try eating before you take the medication. And this will help give you some analgesia, some relief of the discomfort while we're doing the injections. It will not completely resolve it. However, it will help somewhat and certainly worth a try. The next thing is that the injectate is done with a very small needle, 30 gauge. It feels like a mosquito sting. However, one sting is usually very tolerated. If it continues, which we often have to do, it can become a little uncomfortable. And usually what happens is that people start to build up an anxiety while we're doing the injections. So they start to anticipate things even before they've happened. The actual injection only takes maybe a second, and then you feel that pinch, and then the numbing begins because mixed in with the sclerosant is an anesthetic. However, in people's minds, this becomes a sort of a feedback loop, and they get more and more uncomfortable, and it gets very hard for them to tolerate the injections. So the most important strategy is to help calm the mind even before you've started, and continue that process while we're injecting, and that will make it much easier to tolerate. And the strategy actually is using our breath. So a breathing technique will help minimize the anxiety, will help kind of get you through the process. So when we breathe, and we breathe through our nose actually slowly, in and out, it actually activates our parasympathetic nervous system. And this is contradictory or will slow down the effects of our sympathetic or adrenaline or fight or flight nervous system. When that is activated, we feel very anxious, we feel very not calm, and it becomes very difficult to continue with the injections. So what I recommend to people is, even before we've started anything, is to take some nice cleansing breaths. So the idea is to take a deep breath in through your nose, and then breathe out through your mouth in the beginning. And you can maybe use a 4 or 5 count to do this. And I would do that 4 or 5 times to start the process. Ideally, you want to breathe in and out through your nose throughout the procedure. And this will help keep us calm. So you breathe in for 4, 1, 2, 3, 4, and then out, 4, 3, 2, 1. You just count quietly to yourself while you're breathing. Now, the next step is that while you're doing these breathing techniques, is you kind of want to start to clear your mind. Because if you start thinking about the injections, what's happening next, you're going to get caught up in that, and that's going to be very hard to continue. So what you want to do is sort of focus on your breath. You may want to notice, how does it feel? Does it feel warm coming in? You may feel the expansion of your chest. And these are techniques that are used in yoga and meditation. They're very effective. So what you want to do, start with the breathing, start clearing your mind, and really focusing on that breath. And then the next part of it is to really start to just observe. So you start to notice the weight of your hands. You want to relax your face, your jaw, just kind of feel yourself on the table itself. And then when the injections actually start to notice it. So as you're breathing in slowly through your nose and out through your nose, you may feel that pinch. You want to acknowledge it, notice it, but then kind of let go of that feeling. You don't want to hold on to that emotion of anxiety, of fear, of anger, of discomfort. just notice it, acknowledge it, and try to let it go. And each time you take a deep breath in, you're going to breathe in some more energy. As you let go and breathe out, you're going to let go of some of that emotion, and that's going to help you feel more calm. Now, it seems like this is a little basic, however, it is very effective, and it's something you can apply to your entire life. So anytime you're feeling anxious or not calm, or you hear some bad news, or things feel a little unsettled, taking deep breaths in and out through your nose is very effective. The last strategy is an actual topical anesthetic cream. Most common is called BLT, and it's not the sandwich. It is a combination of benzocaine, lidocaine, and tetracaine. These three different anesthetics are mixed together because they each have different properties. The benzocaine is absorbed very quickly and provides a fast numbing effect. The lidocaine produces a more deep effect, but it's kind of a slower onset of action. And then the third is the tetracaine. This kind of works synergistically with the other two to help provide a longer and deeper numbing effect. So you can place the cream on and that will help. And the question becomes, why do we use it every time? Okay, so a couple of factors to consider. One is it's quite expensive. So insurance doesn't cover this, so you will have to pay out of pocket for the cream. If you're trying to cover your entire leg, that'll be a lot of cream and be quite pricey. So we certainly don't recommend that. Number two is if you use too much, these agents actually can be toxic. So there's a limited amount you can use in one sitting. Therefore, you need to be a little sparing with it. And number three is it takes time to work. So the minimum it takes is about 10 minutes. Ideally, you get the maximum effect after 45 minutes. However, it's not practical to spend time at the office to spend 45 minutes and then do another half-hour injections. So these things are not really possible. You can't put the anesthetic on before you come because otherwise it'll wipe off in your clothes. Or if you wrapped it in some, let's say, plastic wrap or saran wrap, it'll cause quite a bad irritation of the skin. Your skin will become red and inflamed, and actually there's no way then to do the injection. So that's certainly not a strategy. So what you can do, and what I recommend, is that we have you go into the room, let's say 10 to 15 minutes before the injections, and try to get as much time as possible. And then you take a small amount of the numbing cream. You should put a glove on first because you don't want to cause numbing of the fingers. And then I would apply it in the areas that are most sensitive. So around the ankle, around the knee, next would be the calf. And if you see a large area of veins on your thighs, you could certainly put it there. That is usually the least painful because it's not so close to the bone. There's more flesh there. But if you have extra, you certainly can use it. And then after 10 or 15 minutes, we will try and start the process. We can also start injecting higher up and move down so that the most sensitive areas have a little more time to numb up. So this is certainly a strategy that can be used. We certainly offer it. However, oftentimes it is not needed. And if you just use your breathing techniques and if you take an analgesic before you come, often that's enough. And it depends on the patient. Some patients are much more anxiety prone. They are fear of needles and they have trouble when they get their blood drawn or anything like that. And so using the BLT cream is a good idea. And sometimes it's just sort of a placebo effect. You know something's being done. It does not completely numb the area, but it lessens the sting of the needle. And that may be enough to get you through the procedure. So if you're interested in sclerotherapy for your spider veins, please feel free to contact us at the Metropolitan Vein Aesthetic Center. We'd love to give you a free consultation to tell you your treatment options. And we can always discuss these strategies as well to get through the procedure. And hopefully we'll give you a beautiful cosmetic results and you'll be happy and able to show off your legs again. Thank you for your time.